Psychodynamic formulation is the assessment and conceptualization that focuses on the development of the unconscious mind. I almost exclusively relied on a particular psychodynamic textbook from the author Cabanis and some co-authors. It's one that we use at the Pittsburgh Psychoanalytic Center. It is easy to digest and practical. So what are we talking about when we say psychodynamic formulation? Well, first, let's just talk about case formulation. So separate from any theoretical modality, case formulation in psychotherapy is understanding how clients think, feel, and behave relative to their problems. Understanding etiology of problems helps to guide treatment direction. It's a living hypothesis, so it's always sort of subject to new data and information. Case formulation should, at this point, no matter the theory, should use a biopsychosocial approach that considers both hereditary and environmental influences, not just psychological ones. We're going to talk about psychodynamic today, but there's cognitive behavioral ones, pharmacological ones, family systems. To give you a sense about where formulation fits in to the bigger picture of treatment, first, we're assessing clients to better understand who they are, what their problems are, and what might be the right treatment direction for them, at least initial ideas about that. Then you build your formulation, and then you use your formulation to guide treatment. It's not a linear process, it's a circle. As you sort of assess further while you're treating someone, that's going to inform your formulation in a different way, and thus treatment is going to be revised. At our practice, when we mandate that you're updating treatment plans every 3 months, it's knowing that you're always getting new assessment information. You always should be updating your formulation and thus the treatment. Psychodynamic is the underpinning of formulation. So what is that? It builds on the Freudian tradition of psychoanalysis by including ideas from all sorts of analytic thinkers that practiced with and after Freud. So it's very broad. It focuses on how the unconscious mind formed in development. So development in this case means the life course through relationships. It focuses on how current patterns in thought, feeling, behavior formed as adaptations to formative relational experiences and unconsciously emerge as problems in the present. And so when I use the word adaptations, I really mean unconscious defense mechanisms or ways that we cope with difficult emotions and thoughts that are often below the layer of conscious awareness. And we'll get more into that. Psychodynamic psychotherapy focuses on what they call organizing ideas about development. So everything from Erikson's psychosocial stages to attachment theory to ego psychology, these are all ideas that help us to understand how to develop. Psychodynamic psychotherapy, it allows us to understand how the mind was created in order to build deeper insight into how it's working now, so how it might be showing up in the problems somebody's experiencing now. It's an umbrella therapy, as I've suggested, with some of these other bullet points that draws on all sorts of other theoretical approaches that focus on development. Some quotes that bring some of the important ideas to the forefront. William Faulkner said that the past is never dead. It's not even past, right? So what we experience in the past very much lives with us in the present. I think I actually read this in that Lori Gottlieb book. If it's hysterical, it's historical. So if somebody is having a reaction to something in their day-to-day life that seems quote unquote irrational, that means it's coming from somewhere deeper. It's coming from their development, from their history. Then from Winnicott, who was a psychoanalyst, we learn to be alone in the presence of another. We learn to be alone in the presence of another. I definitely had to read this one a few different times and sit with it. What I take away from it now is that we are relational creatures and we develop our own sense of self. That's kind of the being alone in the presence of other people. I think in this case, in the presence of a primary caregiver is what he's referring to. It's helping us to structure assessment and treatment planning based on ideas about how unconscious thoughts and feelings affect client problems, ideas about how those unconscious thoughts and feelings might have developed. It helps to explain or anticipate transference experiences that a client may have that you're working with, and receptivity to different treatment approaches you might bring forth. Formulation is always something that's tested and revised as new information comes to light. I thought it would be useful just to talk about psychodynamic case formulation and a cognitive behavioral one with somebody who's coming into therapy for the same issue, or, quote unquote, the same issue. So imagine Sarah, who struggles with anxiety in social relationships. A psychodynamic therapist might explore Sarah's childhood experiences, focusing on her relationship to her parents. They might uncover that Sarah's mother was overly critical, leading her to internalize a fear of judgment. The therapist would help Sarah to understand how these early experiences shape her current anxiety, emphasizing the importance of unconscious processes and unresolved conflicts. And we'll sort of dig into the mechanics of all of that later. This is just a little taste. Compare that then to a cognitive behavioral formulation, who's going to focus on very much the present, Sarah's specific thoughts and behaviors in social situations. They might identify that Sarah has a pattern of thinking catastrophically, believing she will embarrass herself. And then based on that, the therapist would focus the treatment on challenging her negative thoughts and building new coping and helping her to face her fears through exposure. This is pros and cons, but it's actually just pros. One pro of this psychodynamic approach is it helps people to gain really deep insight that isn't as possible from a more present focused approach, because it helps you to get more into somebody's unconscious motivations, and that can lead to profound self-understanding. It explores emotions, relationships, and other patterns that might be affecting current behavior. So it's like taking a really deep dive, looking underneath what you're seeing in the present. And then, what the research suggests is that, long-term psychodynamic psychotherapy leads to longer-term change after therapy ends, because it's really addressing personality change, quote unquote, root causes of symptoms rather than just the symptoms themselves. How to actually use psychodynamic formulation. You can think of it like a map to guide every aspect of treatment, from how you greet the client at the beginning of the session to the interventions you use and the ways that you reflect back information. Also to help you to make concrete treatment recommendations and do goal planning together with the client. Helps you to form your therapeutic strategy to identify the maladaptive developmental need. It helps to give the client a life narrative that can help to build self-esteem and identity. So I'm experiencing problem X because of developmental issue Y. And you might share it with clients, depending on the client, to build rapport and the working alliance that you have with them. But that really depends on how self-reflective or psychologically minded the client is, because it just might be too confronting. And then we already talked about the working alliance. Okay, so the meat of this presentation is going to focus on a three-pronged approach to psychodynamic formulation. The first is describe. The first part of building a formulation is describing a client's problems and patterns that is focused on what's happening for them in the present. And so we're going to go into that in a more detailed way. The first thing that you identify is, why did this person come to see me now? What is the problem that they have in mind for why they're here? And we might agree with that as being kind of the main problem that they're experiencing in their life. We have to acknowledge and address. Describing the problem is also describing the symptoms and whatever diagnosis they seem to have. But then separate from the problem, in psychodynamic psychotherapy and formulation, you also are describing the person, which is beyond the problems and symptoms, into looking at the patterns of how the person thinks, feels, and behaves. If you think about it, it's like two people, that same example that we had earlier, like two people come in for what they're calling social anxiety. That could look so different from person to person. It's really not specific and doesn't give us a lot of information about the person, which is ultimately what's underneath the symptoms. So in order to describe the person, we have to assess their patterns and functioning. And this book, the Cabinus book, suggests these different areas to explore, a person's functioning from and thinking about each one in a dimensional way, from more to less adaptive ways of functioning. And we'll get into each one of them. And then in addition to looking at those dimensional areas, there's also what a client tells us versus what they show us. How do they talk about their problem or symptoms is often really telling about who they are and how they understand themselves, right? So in this psychodynamic approach, we're always looking at what might be happening unconsciously. This first area is the self. The textbook breaks that down into two main categories. One is self-perception, and then the other is self-esteem regulation. Self-perception can be further broken down into identity, including our sense of who we are, our likes, dislikes, talents, limitations. If you think about that concept of more adaptive to less adaptive, this dimensional view of each of these points, a less secure identity might lead to more difficulty making choices and a more erratic life path. A more secure one may allow for somebody to feel more confident in the choices that they make and feel more satisfied by them. The second one under self-perception is fantasies of the self. Fantasy of the self is like thinking about ourself in the future in a way, and it can be comforting. It can help us to set goals. It can help us to escape our present. It can serve as motivation to strive and achieve. When we're not particularly attuned to our talents and limitations, fantasies of the self can lead to negative self-perception. There's an example that I saw recently. A 65-year-old waitress has dreams of being the top opera singer in the world and has those fantasies about herself. It might lead to some depression in the present because it's so far from her current capacities and where she is right at that moment. Not to say that it isn't possible. And then there's self-esteem regulation. What that means is how we pick up ourselves after disappointments or slights or perceived slights. One idea under that is vulnerability to self-esteem threats, which historically has been referred to as narcissistic injuries. So threats could be a medical illness, a job loss, or just be somebody looking at you the wrong way. How somebody reacts to each of those things gives you some sense about their vulnerability to self-esteem threats. There's also internal responses to self-esteem threats. How does somebody buoy themselves in the face of self-esteem threats. There's more adaptive ways and then generally less adaptive ways. So in response to a self-esteem threat, somebody might resort to grandiosity and narcissism, or they could resort sort of on the other end of less adaptive to self-deprecation and masochism. And then more adaptive ways could be using humor, altruism, or sublimation, which I always have to remind myself what that one means. But I think of the artist who sublimates their inner turmoil into some masterpiece. The last piece about the self is how you use others to regulate self-esteem. I'm sure you've come across people who have that constant need for attention, praise, and validation, whereas others may be totally shut off to that. And each comes with their own sort of challenges. The next area of functioning is relationships. That includes how people trust. Some people might have difficulty trusting others, which can lead to skepticism, vigilance, bitterness, and ultimately isolation. And of course, being overly trusting can be a challenge too. There's how somebody understands their sense of self and others. And with this, historically, we're thinking about the concepts of splitting and mentalization. Does somebody resort to thinking about themselves or others as either good or bad? Can they separate their own feelings and needs and motivations from those same things from somebody else? And are you able to consistently experience someone more or less the same way over time, or is that very erratic? These particular things that I'm talking about kind of on the less adaptive end, we see a lot in borderline personality disorder, for instance, but it's a spectrum. And then there's security, and that really refers to what we think of as a secure attachment from attachment theory. There's intimacy, like how honest and open is somebody able to communicate with significant others in their lives. If they're not able to do those things, relationships might always be a bit superficial. And then there's the concept of mutuality. Is somebody more of a giver, a taker in relationships, or are they sort of flexible in being a giver at times and a taker at other times? Again, just to reinforce this, you take the dimensional view with all of these different areas, from more adaptive to less adaptive, and understanding where somebody might be less adaptive can help you to understand how they might be experiencing the problems that they're experiencing in the present. Then there's the concept of adapting, which really means how do they respond to stress? Here I use the language internal and external stimulation, but really that just means stress. There's different ways that people adapt to stress, and we'll go through each one of them. The first is defense mechanisms, and this is the bread and butter of psychodynamic psychotherapy. Maybe others disagree with me, but defense mechanisms are kind of ranked from more quote unquote primitive to more mature. So the primitive ones are the ones that tend to disconnect us more from thoughts and feelings and reality, and then the more mature ones, they tend to be a bit more connected to thoughts and feelings. We're not going to go through each one of these because it's going to take too much time, but thought I might just skip around to see a few. So the first one under primitive defense mechanisms is denial. That means refusing to accept reality or to avoid a painful event or emotion. You see this a lot in addiction, somebody denying that they have a drinking problem, despite evidence to the contrary. And they're splitting. Number 4, which we've already talked about, that sort of all good or all bad, not being able to hold multiple things in your mind at once. Then slightly less primitive, they call the immature defense mechanisms. A couple here, somatization, so converting physical distress into physical symptoms. An example being that a person might develop unexplained headaches when feeling overwhelmed emotionally. There is passive aggression. Everybody knows what that means. Then slightly less primitive would be the neurotic defense mechanisms. These are all kind of classical psychoanalytic terms, which have different meanings in kind of the popular lexicon. One here is repression, unconsciously blocking acceptable thoughts or impulses from conscious awareness. An example being that a person may not remember a traumatic childhood event, though it still affects their behavior. Another is intellectualization, using logic and reasoning to avoid emotional distress. A person diagnosed with a serious illness focuses on researching the disease rather than addressing their fear. Then we have the mature defense mechanisms. We already talked about sublimation. In addition to that, there's suppression. So consciously, as opposed to unconsciously with those more primitive defense mechanisms, you're choosing not to think about a distressing thought or feeling. So you actually use suppression a lot with concentration-based meditation practices. It's like, I have this other thought. While I'm trying to focus on the breath, I move the mind back to the breath consciously with intention. Then there's humor, using humor to cope with stress or emotional pain without causing harm. But even these mature defense mechanisms, it's like if you over rely on them, then they can become less adaptive too. In addition to the defense mechanisms, there's impulse control, an important aspect of how people adapt to stress. Somebody who has less impulse control might see them dealing with a lot of addictive behaviors. You might see them displaying some antisocial behavior, things that are illegal. But on sort of the opposite end of the spectrum, somebody who's way overly controlled can have trouble being spontaneous. That can pose its own issues in relating to others. There's managing emotions. We certainly all know about the challenges of difficulty managing emotions and what that brings. But there's also, being overly controlled in how you manage your emotions, right? I have to imagine that life feels pretty colorless if you're overly controlled and thus kind of can't feel your emotions. A lot of these things sort of overlap with each other. Some of the defense mechanisms are like kind of embedded in some of these other ideas. Somebody who's very managed emotionally, as an example. Then on top of all of those things, there's sensory regulation. Like, we all are born into this world with different sensory profiles. And so that can really dramatically shift how we respond to internal and external stimulation. And so that's just an important thing to keep in mind as you're describing a client. Then there's cognition. That includes, general cognitive abilities, memory, attention, speech, language. Most of those things require formal testing to get a deep understanding of. But, as therapists, we can observe clear strengths or difficulties in those things, and those can help us to understand a person. There's how people make decisions and problem solve. Are they impressionistic? Are they very research driven? Are they very detail oriented? Are they very intuitive? It's not really for us to judge if one way is better than the other. Rather, what's useful here is for us to explore how the styles might be affecting their functioning and their problems. Then there's self-reflection, which includes psychological mindedness. What is the person's capacity to reflect on? In psychotherapy, we're trying to give clients more agency over their lives, and that requires some self-reflection about how they might be involved in some of the conflicts that they're experiencing. And people, there's a real range there. There's reality testing. A lot of times during stressful situations, people lose the ability to differentiate fantasy from reality. So that can be a real challenge. There's judgment, which in the classical psychoanalytic way, they would talk about in terms of superego function, but that's really like knowing right versus wrong and moderating your behavior connected to that. And then work and play, and we already talked about relationships. Freud famously said that people need to be able to love and work, and that that's one of the goals of therapy, is to help people to love and work. But, we talked about love already to some extent with relationships. And so this textbook uses work and play as a dimensional category. You're looking at how well matched is the person's work and the ways that they play to their developmental level, talents, limitations, how comfortable and satisfying, how much purpose do they get from the work and play, how well are they able to care for themselves and their dependents based on those things, and then how culturally sanctioned are those things. Is it substance abuse? Does it harm others? Is it illegal? All of that helps you to understand a person in terms of this category. So that's a lot. To borrow from Shrek, right? People are like onions, and you can only peel back the layers as you are able to peel them back. And so when we're starting out with a client, right, we're really not going to be able to get to hit like every single one of those bullet points, because it's just, we would have like 20 sessions of assessment just to get through them. Certain things just aren't going to come up because you didn't ask the question the right way, or the client, that part of their like awareness is just kind of like locked down because there's not enough trust in the relationship with you. It just takes time. I share all of it and they talk about it all in the textbook just as things to keep in mind as they're formulating. We just talked about describe, right? How do you describe the problem somebody's experiencing and the person who's experiencing the problems? The second of 3 steps in this formulation process is to review. And so while the first step was very present focused, the review is more past focused. You're looking at their developmental history. So a couple important themes here. It's biopsychosocial, so you're looking at both nature and nurture as you're understanding their development. You're looking at formative relationships and how those affected the client. Understanding trauma is really necessary. Understanding the order in which things happen can help you to understand what are the kind of root things to be looking at, to be focused on. How did one thing impact another? While historically there was perhaps way more focus on early childhood experiences in psychoanalysis, we now know that development is lifelong. Keep that in mind as you're doing your history. The authors here break down a developmental history into these different sections. I had the idea that I was going to read a bit from the book about each of them, but I'm not sure that I'm going to have time. So instead, I'm just going to use some of my notes. And if we have time to do more at the end, maybe we can come back to it. So with understanding somebody's development, the first piece to know about is their genetics and prenatal development. And while we aren't running genetic tests, and oftentimes we're not able to speak to a client's parent, we can still get at some of that information by understanding about a family history of psychiatric disorders and any very persistent temperamental traits within a family, between different family members. We can also ask about any known adverse events during pregnancy or birth that may have affected the client. And we can also ask about maternal health during pregnancy. The very early years, those are super important for establishing capacities for trust, attachment, stable sense of self and other, learning how to regulate emotions, learning language, and developing cognition. These years are primarily or strongly influenced by relationships with primary caregivers, forming secure attachments with them or not. And because autobiographical memory doesn't usually start until around age 3, the client isn't going to be able to share a ton of knowledge about that. So instead, as I mentioned before, we're getting information about this not just from what they tell us, but from what we observe and how we experience the client. We call this implicit memory, how the person unconsciously behaves and relates. Our experience of them can give us some insight into perhaps their experience in their early years. Then there's middle childhood, just important ideas that this when the sense of self is really strongly developing, and particularly around bodies and sexuality, relationships to others, and how people relate to competition. It's also when morality is forming. You want to be asking, because now the client will have some autobiographical memory from this period. You're going to be asking about their relationships with their caregivers and their siblings, how others responded to their sexuality, what their experience was of jealousy or rivalry. Later childhood and beyond, a lot of the stuff that I'm sharing about now is you can find from Erickson's work, but you want to be paying particular attention in your assessment to how the client did with skill building in school, how they established themselves in their world of peers, looking to see if maybe there were unrecognized cognitive or emotional difficulties like ADHD or bipolar disorder that may have impacted their development and self-esteem at that time. And then adolescence, it's all about identity, right? As I'm sure you all can relate back to that with yourselves. People are trying on all sorts of different identities. It's also when they're present with fears and inhibitions about sexuality, and many cognitive and emotional difficulties first appear in adolescence. So you would want to be sensitive to all that in your assessment. It's also when eating disorders and substance use might start. Looking at all of that is going to be really important to understanding the person. It's also when somebody's sense of self and self-esteem and mastery over their environment, all of those processes are taking place. You want to be exploring with the client how their process of experimentation with all of those things, whether they found some mastery with those things, whether they kind of solidified some ideas there, or whether they were not able to experiment for different reasons, or the experimentation just never stopped. All of that is just very relevant to understanding someone. Early adulthood, you're looking at how people connect intimately with lovers and relationships, how they're caring for themselves independently, away from parents. There's so much beyond. One idea to keep in mind beyond early adulthood is, how is this person creating meaning in their life or not? And if not, how are they relating to the absence of that? Is there a lot of bitterness? Is there other stuff? The third piece of formulation is to link the first thing that we talked about, describing, to reviewing. You're linking current problems and patterns with a client's history using organizing ideas about development. What that means is you're focusing on what's been described and reviewed, what you've described about the person and their problems, what you've reviewed about their development, to hone in on the patient's or client's greatest areas of difficulty and most problematic aspects of development, because it's just too hard to try to focus super broadly on them. So you need to focus it in order to have something actionable to do in psychotherapy. And the ways that you do that is to focus on what has been described or what you've described about the client. Think about like two people coming in complaining about trouble at work. One explains that everybody is out to get him. Based on that, you might ask the question, why is he having difficulty with trust? The other person who's having trouble at work explains that he doesn't know what he wants to do in his life. So you might ask the question to sort of focus your description. Why is he having difficulty with identity? Then when you're focusing your review, you're looking at the points in development that were most likely to have disrupted healthy development. As a rule of thumb, global problems in function, rather than more circumstantial ones, tend to arise earlier in somebody's development. There were some points in development where things happened that disrupted healthy development earlier on. And then more circumstantial problems tend to arise with issues in development that happened later in someone's life. And so you're using these broad categories, which we don't really have time to get into, so I'll just go over them really briefly to link, the describe with the review. So you're looking at trauma, you're looking at early cognitive and emotional difficulties, you're looking at conflict and defense, relationships with others, the development of the self, attachment. And so just as very brief, because we're pretty much out of time, examples of ways that you could link what you have described and reviewed is how might early trauma, right, so that's from development, lead to problems with affect regulation. That's something that's happening right now. How might an absent mother from development lead to interpersonal problems in the present, in adulthood? How might an overly close relationship with a parent from development lead to sexual inhibitions in the present? A few examples of how you can take the link that you've developed between what you've described and what you've reviewed to help guide treatment. To link adult problems to early trauma, you then focus the treatment on helping the client to understand their trauma and repair the disruptive development that occurred around that trauma. To link problems to unconscious conflicts and defenses, a treatment direction is to help to develop more adaptive ways of dealing with problems. These are very simplistic, and I apologize that there's not more time to get into this deeply. I wanted to read a more detailed case formulation, but this should just give you a taste of things. I appreciate you all coming.